If you're suffering from vaginal dryness or discomfort down there, or maybe you're getting more UTIs, then this video is for you. Let's talk about the vaginal changes that are associated with menopause and dryness specifically. I'm Dr. Jen. Welcome back to my channel. I'm a hormone and metabolic health expert, double-boarded OBGYN in integrative medicine. We're going to talk about a topic today that just doesn't get a lot of recognition, and that's vaginal dryness in menopause. A lot of women suffer from vaginal dryness. In fact, probably half of the women that I see in my clinic start having this as an issue, even in perimenopause and even before perimenopause. But we're going to talk specifically about menopause, what causes this, solutions, what to do now. So first, what is vaginal dryness? Vaginal dryness is a common symptom women have, and it happens when estradiol levels start to decline. So when you're going through perimenopause and then ultimately menopause, your ovarian production of estradiol starts to go down. And in fact, it becomes even so incredibly low that you don't have cycles anymore. And that lack of vaginal estrogen causes several things to happen in the vaginal tissues. First of all, the actual thickness of both the layers below the mucosa and mucosa become less, so the tissue becomes thinner. It becomes more susceptible to trauma, so you can feel more burning sensation or you don't tolerate sex as much. You actually have less lubrication because the estrogen is actually needed for the cells in the vagina to make lubrication. So when you don't have that, you have less lubrication. You also have changes in the vaginal pH because the bacteria in the vagina, specifically lactobacillus, they make glycogen, which actually helps overall with discharge and with lubrication. And when that happens, it changes the pH. And instead of being the nice acidic environment that it was, it becomes more alkaline. So you actually have less colonization of the good bacteria and start having colonization of the bad bacteria. Hence why women start noticing they have more UTIs or bacterial vaginosis when they go through menopause. So estradiol is incredibly important for the normal health of the vaginal tissues. And I don't want to say it's just estradiol because testosterone or androgens are also incredibly important in that area, but specifically we're going to focus on estrogen. So other factors that can actually make vaginal dryness worse, believe it or not, smoking not just affects your lungs, but actually affects the vaginal tissue as well. Medications like antihistamines and antidepressants can cause drying of the fluids everywhere in your body, but also the vaginal fluids. And then using scented soaps or douches can also disrupt the pH of the vagina, which can lead to dryness issues as well. So knowing the cause helps you find the right solution. So how do you treat vaginal dryness? Okay, so for this part, let's talk specifically about different options that can be used. First of all, there's always over-the-counter lubricants. So lubricants are very different than moisturizers. So lubricants are just helping to lubricate the tissue. They're kind of a small, simple moment solution, right? It's not going to actually help you retain moisture, but used often during sex to help make sex more comfortable. And most importantly, to check on making sure that you're using a lubricant that doesn't have a bunch of extra stuff in it, perfumes or dyes or scents, because that can really cause the vaginal tissues to be irritated. Vaginal moisturizers, this is my favorite. It's called Vag of Honor from IM Stripes. What's so great about this is it has hyaluronic acid, it has moisture, it gives you moisture, it retains moisture, and then it helps with the vaginal mucosa tissue to make sure that that tissue is staying nice and healthy. And then if you combined it with like estradiol in the vagina, that's like the best combination. So this is one of my favorites. I also will tend to do compounded suppositories for patients who maybe don't want to use vaginal moisturizer in this form, but maybe want a suppository, and you can use vitamin E, hyaluronic acid, and estradiol in a suppository. So estrogen therapy, like I mentioned, is also very useful for dryness. And I did a whole video on vaginal estrogen. So check that out if you want to know specifically about the different types. But vaginal estrogen comes in a lot of different varieties. You can use the cream, which is called estrase, and you just put a pea-sized amount on your finger and just go right into the vagina. It can be put right underneath the urethra and right on the vulvar tissues as well. You can also use the estring or vaginal tablet called Uvafem or Vagifem. And then there's clearly compounding options too that can be used with both estriol. You can add DHEA DHEA, you can make estradiol. I mean, you can make anything on compounding. And I tend to do that if women have tried these products and it's not seeming to be working, or they need something a much smaller dose or a dose specific for them. So you can also use vaginal DHEA. So DHEA is an androgen, and there are androgen receptors in the vagina, and that can improve vaginal tissue, the thickness, improve sexual sensation, sometimes even improve libido. Some women have described it actually helps with libido, and it works by also helping with conversion to estrogen locally as well. And then lastly, a good healthy microbiome is really, really critical. So the vaginal tissue needs to also be full of good blood flow, plump and working, but you also need to have good bacteria, and the vagina also needs to be acidic. So I often recommend probiotic that has specific strains for the vagina, and I like the Vaginal Wellness Pro from Physician's Choice because it not only has the right type of lactobacillus, but also it has D-mannose and cranberry, which can be great for urinary health as well. Lastly, I do want to say that some women actually get a lot of benefit from using vulvar balms, because if you're having vaginal dryness, you might have vulvar dryness, or you may have a condition like lichen sclerosis or lichen planus, where you tend to have more tissue that's dry. So I often will recommend vulva balm. I like this one from Medicine Mama because it's organic, it's very simple. You don't want a lot of things to cause irritation, but you can also go as basic as just using coconut oil in that area, and that's okay too. So make sure you find something that's actually doesn't have a lot of scents or perfumes or dyes or additives, because that will really cause more issues. So those are some options on how to treat vaginal dryness. Remember, all of these you should consult with your physician, because you want to make sure you're taking the right thing for you, and you want to make sure you're taking the right dosage. So it's important to make sure you consult with your healthcare provider. Lastly, I just want to say, it's a very common problem to have vaginal dryness, and you're not alone. There are a lot of women, in fact, 1 in 2 women have vaginal dryness as they go through menopause, and it's really important to know that there are options for you. You don't have to suffer, and you don't have to feel alone, because there are women who can help you and providers who are trained in menopause care to help you along your journey. So if you liked this video, please like and subscribe, and give me some comments. Let me know what's worked for you. I know there are a lot of women who use all kinds of things, so throw them in the comments to help other women. Thank you.